All right, here is your coffee.
Thanks, Mum.
How's everything going? These assignments and stuff.
Can we not talk about it? It's due tonight. I barely got anything done. I'm stressing. My head is hurting. I can't. I'm over it.
Okay, that's all right. What's going on with your face? What's happening? Oh my god! Talk to me! I need to call the ambulance.
A few moments later.
Hi Annalise, my name's Lauren and I'm the nurse looking after you today. Can you tell me a little bit more about what happened? So Mum, did you want to tell me a little bit more about what happened to your daughter today?
Her face just started drooping all of a sudden and she was slurring her words.
Okay, how long have these symptoms been occurring?
For about 15 minutes.
Okay, have they improved or got worse?
No, I think they stayed the same.
Okay, well I'm going to take your daughter's vital signs now.
Nurse, you need to tell me what's going on with my daughter.
Okay, well look, I can't diagnose, but from what I've heard, I do believe your daughter is suffering a stroke. The main concern is that we need to act fast.
What? Do what you need to do.
Okay.
Moments later.
Alright Annalise, I'm just going to pop this on your finger now. This is just going to measure your oxygen saturations. We'll also apply some oxygen on high flow. Don't worry, it's all okay. Everything's alright.
What's that going to do?
This is just going to increase her oxygen flow.
Okay.
Alright.
It's okay, Annalise. Everything's going to be
your blood
okay.
pressure now.
More moments later.
So what's next, nurse?
Alright, so Annalise, I'm just going to lay you flat. This is going to reduce the intracranial pressure. It's also going to facilitate blood flow to the brain.
Okay. Annalise, everything's going to be okay. I'm right here.
The main thing we have to do for Annalise is make sure she receives the correct care. We must minimise the risk for increased intracranial pressure. This needs to be done urgently. I'm going to contact her admitting doctor and let him know what's happening. We will go from there. Don't worry, she's in good hands.
1 minute, 37 seconds later.
Hi doctor, do you have time to discuss the patient?
Yeah, sure.
Okay.
What do we have?
So look, I've taken her vital signs.
Wait. I have no idea who this patient is.
Rude.
So the patient is Annalise Smith. She's in bed 2, 25-year-old female. She presented with left side facial palsy, slurred speech, headache, left-sided weakness, blurred vision and dizziness. Her oxygen levels were less than 95%. We applied oxygen therapy through nasal prongs. Her BP was a little higher than usual. Her airways were clear.
Is that a neurological ob's been taken?
So we checked her neurological function through the Glasgow Coma Scale to measure her level of consciousness. Her eyes did open spontaneously to my speech each time I walked into the room. She responded to my stimuli. No painful stimuli was initiated. Her verbal response though was on the lower side. At times it wasn't orientated and she was a little confused. She was understanding what I was saying though. Her motor response was good though. She was obeying commands. I think I'm going to leave it in your hands.
Okay. Looks like we have symptoms of a stroke, so we're just going to need some MRIs and CT scans and we'll go from there. Sounds good? So diagnostic tests for suspected patients when you think of had a stroke must be performed urgently to determine, number 1, if the patient's had the stroke, number 2, what type of stroke has occurred, number 3, how has it occurred, and number 4, its impact on the brain. The faster the stroke is diagnosed, the quicker treatment can begin, and the less likely a mini stroke will occur, resulting in positive patient outcomes.
5 minutes later.
Hi Annalise, my name is Dr. Davis. I'll be looking after you today. Hi, so what was your name, Mum?
Zoe.
Nice to meet you. So I'll be looking after Annalise. So Nurse Lauren has already informed me about Annalise and her situation and her vital signs. So I think it's best if we do a CT scan and MRI, just because we suspect that she might have had a stroke.
So what's the CT scan going to do?
So CT scans is an X-ray procedure that will give us a 3D image of the brain. And an MRI is an imaging technique that will create a clear image of your brain, allowing us to see if a stroke has occurred and what type of stroke has occurred.
Okay.
And they allow us to see any blockages in the brain.
Alright.
So we'll be doing that now, okay?
Okay.
I'll leave you with Nurse Lauren and she'll take you down.
Is it painful?
No, it won't be painful, it'll be fine. It'll be quick, a quick procedure.
Okay.
I'll see you afterwards.
Thank you, doctor.
A little later.
Let's have a look at the MRI. So it shows that there's no blood flowing in the brain and there's inflammation. So there's no bleeding, but there is a lack of blood flow in the brain because of the blockage there in the cerebral artery. So this shows an embolic stroke. Okay, so the results from the scans show that there is a blockage in the cerebral artery like we thought. So that means there's perfusion difficulties, so that detects that we've got an embolic stroke. And as you got to the hospital really quickly, there's been minimal damage to your brain tissue, so recovery is looking positive.
That's good. So what happens next?
So there is a special treatment that we can give to Annalise because she got to the hospital so urgently and quickly. The blockage in your cerebral artery can be treated using a medication called
Alteplase!
Oh, hello. I didn't see you there. What were we talking about again? Oh yes, Alteplase. So, Alteplase is the only drug approved by the FDA to treat ischemic strokes. Alteplase restores blood flow to the brain and that have been affected by strokes, helping to prevent further damage. For those of you at home who love pharmacology, let me tell you some interesting facts about Alteplase. It's a synthesized enzyme called tissue plasminogen activator, also known as TPA. When this medication is introduced into the circulation, it binds to the fibrin in a clot. Inside the clot, it converts plasminogen into plasmin, and plasmin is an enzyme that actually breaks down the fibrin, therefore dissolving the clot. Alteplase is the only drug approved by the FDA to treat ischemic strokes. It's time sensitive and can only be given within 3 to 4.5 hours of the onset of stroke symptoms. That's why it's important to get to the hospital fast. This medication has been known to limit stroke damage, improve patients' chances of surviving without any neurological disabilities and long-term symptoms. It greatly speeds up recovery. However, there are some risks. It can increase the risk of bleeding from anywhere in the body, especially the brain. So before giving Alteplase, we need to know the major contraindications. These include So in our situation, Annalise is a prime candidate for Alteplase treatment because it's only been 40 minutes since the onset of the stroke symptoms and she's arrived in hospital. She has no intracranial hemorrhages as seen through the CT and MRI scans. She's got no hypertension and no medical history of any bleeding or clotting disorders. Therefore, it's okay to give her Alteplase.
2 very boring minutes later.
So what we're going to do is we're going to begin with IV infusion of Alteplase. Yep. So the recommended dose is 0.9 milligrams per kilogram.
Yep.
And the maximum dose is 90 milligrams.
Sure.
So the first 10% of the dose is going to be given as an IV bolus over 1 minute, so we'll all be timing it at the same time.
Yep.
And the remainder infused over 60 minutes.
Sure.
So shall we begin?
Annalise, we're going to keep a close eye on you, okay? We're going to give you your medication shortly.
Neurological assessments, blood pressure monitoring will continue throughout treatment. Be on the lookout for headaches, vomiting, acute hypertension, signs of hemorrhages. If that occurs, then the infusion treatment will need to be discontinued and another urgent cranial CT scan must be done.
2 hours later.
Okay, Annalise, so the TPA therapy went well. There was no complications. We're just going to continue to monitor you closely, but for the moment, just relax, take it easy.
So Lauren, the plan is we're going to avoid anticoagulant and antiplatelet therapy for 48 hours.
Yep.
After that, I think we should start aspirin 100 milligrams low dose just to prevent secondary strokes from occurring.
Sure.
And we'll transfer Annalise up to the stroke ward.
Okay, not a problem. I'll organise that now.
Thank you so much.
Much later. Much later. Much later.